Let me introduce myself. My name is Lizette Boda, and I am a district representative for the office of Congresswoman Escobar. We will have a Q&A session after the presentation, so please go ahead and use the Q&A function to submit your questions, and we will take some time after the presentation to answer those. And with that, I'm going to turn over the presentation to Dakota, and yes, thank you so much for being here.
Hi, everyone. Can you hear me okay? I guess I can't really see how this works, but comment in the chat if for some reason you can't hear anything. But I'm so excited to be here. My name is Dakota Jablon, and I'm the Mental Health Legislative Advisor at SAMHSA, which is part of the Department of Health and Human Services. And I'm also a former district staffer, and so it's really exciting for me to present to this district and the importance of the district office. So just really excited and thankful to Representative Escobar's team for inviting me. So today we're going to talk about SAMHSA Center for Mental Health Services. It is Mental Health Awareness Month. We're just wrapping it up. And so I'll be talking about future grant opportunities, just information about SAMHSA and our Center for Mental Health Services, as well as definitely leaving time for a Q&A. Did someone say about any issues? Can you hear me still okay?
Yes, you're
okay.
fine, Dakota.
Okay, just making sure.
Sorry, no problem.
No, it's okay. All righty. So a little bit about SAMHSA. We are with Congress actually established SAMHSA only in 1992. So we've been around about 30 years, and we used to be doing this just part of HHS. And now this is a separate sub-agency within the Department of Health and Human Services. And our purpose is to lead public health efforts to advance behavioral health of the nation. And our mission is to reduce the impact of substance abuse and mental illness on Americans' communities. And so we issue a lot of grant opportunities. We are primarily a program-based committee, and we also house TA centers and are involved in kind of anything of mental health. So within SAMHSA, there are multiple centers, and I am part of the Center for Mental Health Services. And so CMHS, the Center for Mental Health Services, all of the grant programs, all of the work that has to do with mental health is in our center. And so we lead federal efforts to promote the prevention and treatment of mental disorders. And so what our kind of aims and goals are as a center is we work to strengthen the nation's mental health system by helping states improve and increase the quality and range of their treatment, rehabilitation, and support. So we issue a lot of grants to states as a whole. We make it easier for people to access mental health programs. We encourage a range of programs such as systems of care to respond to the increasing number of mental, emotional, and behavioral problems among America's children. We support outreach and case management programs for the thousands of Americans who are homeless, and we support the improvement of those services. And we ensure that scientifically established findings and practice-based knowledge are applied in preventing and treating mental disorders. So we really try to make sure that all of the federal dollars that go out are supporting evidence-based or evidence-informed treatment, intervention, prevention efforts. So within the center, as you can see, there's a lot of levels at SAMHSA. So there are 3 specific divisions within the Center for Mental Health Services. So we first have the Division of Prevention, Traumatic Stress, and Special Programs. And within that, there are branches. So we have the Emergency Mental Health and Traumatic Stress Services branch, the Mental Health Promotion branch, and the Child and Adolescent and Family branch. Then we have the Division of State and Community Systems Development, and that's where we have the state grants, Eastern and Western branch. So everything there is really focused at the state level. And then finally, the Division of Service and Systems Improvement. And within that, we have the Suicide Prevention branch, Homeless Programs branch, and Community Support Programs branch. So within those, that's where all of our grant programs fall under. So under that first division, we have under the Child, Adolescent, and Families branch, we have the Clinical High Risk for Psychosis Grant Program, the Children's Mental Health Initiatives Grant Program, Circles of Care, Disaster Response Grant Program, Healthy Transitions, the Statewide Family Network. All after the Children, Adolescent, and Families branch, we have the Mental Health Promotion branch. And that is really promoting mental health and providing those prevention services as opposed to treatment and intervention. So we have the Project Aware Grant, the Project Launch Grant, Mental Health Awareness Training Grant, the Recast Grant, Indigenous Project Launch, and the Infant and Early Childhood Mental Health Consultation. And then in the Emergency Mental Health and Traumatic Stress Services branch, as you can see, they all kind of have to do with trauma. So National Child Traumatic Stress Initiatives. There's the treatment and services, there's the community services, and then there's the supplemental grants, and then as well as the crisis counseling program. And then also within each of these branches, we have technical assistance centers, and those are funded through SAMHSA, but 2 grant recipients receive them. And I'll go into a little bit about them later, but they usually have to do with whatever this branch is under. So of course, the National Training and Technical Assistance Center for Children, Youth, and Family Mental Health is under the Child, Adolescent, and Families branch. And this is a TA center for SAMHSA grantees that are having these grants, but they're also available for the public. And so, like I said, I'll get into a little bit about that later. The next division we have is the State and Community Systems Development. And within that, we have the Community Mental Health Centers, the Minority Fellowship Program, Mental Health Block Grants. That is a grant that every single state gets, and there's certain levels of funding based on the population and certain required set aside, but every single state gets that grant. The projects for assistance in transition from homelessness, protection and advocacy for individuals with mental illness, and disaster response state grants. Finally, we have the Division of Service and Systems Improvement. So the Suicide Prevention branch has a host of grants. We have specific grants around COVID. We have youth suicide prevention grants, college campus suicide prevention grants, tribal behavioral health, so specific suicide prevention for tribal entities. The Suicide Prevention Lifeline is housed within this branch. Zero Suicide, which is for hospitals, and then the TA centers. The Community Support Programs branch, we have these certified community behavioral health centers, integration of primary behavioral health care, promoting behavioral health care integration, the statewide consumer network, and supported employment program. And then finally, the Homeless Programs branch, where we have the Assistant Outpatient Treatment Grant Program, the Assertive Community Treatment Program, Behavioral Health Partnerships for Early Diversion, Cooperative Agreements to Benefit Homeless Individuals, Disaster Response Grants, the Minority AIDS Grant Program, and Treatment for Individuals Experiencing Homelessness. So as you can see, we have a ton of grant programs within SAMHSA, and many of these are 5-year grants, some are 3-year grants, and some are 1-year grants. So now, before we go into some of the current grant opportunities that SAMHSA has, I want to give a little bit of information about the technical assistance centers, because there are so many that are very specific to, a very niche idea or a niche program. But like I said before, they're 100% publicly available. And so on our website, and I'll make sure to also, well, the link is there, that can follow up with links as well. So on SAMHSA's website at the top, you just go to practitioner training, and there's a list of kind of some of the top ones that people go to. So the Suicide Prevention Resource Center is there. But if you click at the bottom, it'll expand to all of the TA centers. And this is across SAMHSA. So I'm not highlighting the ones that have to do with substance use, because those are in a different center than the Center for Mental Health Services, but they are also available through that link. So here is the TA centers that exist within SAMHSA. As you can see, there are a ton of different ones having to do with disasters, children, suicide, There's specific ones about American Indian Alaskan Natives. There's one for Hispanic and Latino people. There's one for veterans. There's kind of, again, every single niche of behavioral health, mental health, and substance use, there is probably a TA center for this. And so every single one of these has a website that you can go to, that sometimes you can actually ask some of the people that work there for individual technical assistance, but they also have webinars, they have newsletters they send out, they have technical assistance documents that they put on their website, best practices, links to external resources. It's kind of like a one-stop shop for everything you could think of in this one particular area. And so we also are creating new centers all the time based on when Congress authorizes new programs. And so right now, we just put out a listing for a new center of excellence on social media and mental health. And so eventually soon we will have one of those up here as well. So switching gears, we're going to talk now about how to find grant opportunities. And so as you saw, we have a ton of grant programs, which means there are a ton of grant opportunities. And they can sometimes be a little tricky to find because when they're posted is different of being forecasted. So right now, if you go again to SAMHSA's website, at the top, you'll see grants. And if you click on that, you can click fiscal year 2022 grants. And then it'll bring you to this picture on the right side of the screen. And then you can decide if you want to look at all SAMHSA grants or specific by center. So CMHS is the Center for Mental Health Services. So if you only want to see what grants are available within mental health, you could look by center. Many of our grant programs, we just finished our funding opportunity announcement. So a lot of the applications have ended. This is something though that continues throughout the year, especially with funding kind of came in late because of the continuing resolution from Congress. And so the timeline is kind of different every year based on when grants are posted, based on when we finally have our new budget set in place. So we do have though 2 grant opportunities that have actually not been officially posted on the website, but they're considered forecasted. So we are expecting them to be posted officially soon. But on grants.gov, we actually are able to, which also, as you can see here, on grants.gov, they have the forecasted opportunity. So I'm able to talk about it. We just don't know exactly when it will be dropped on SAMHSA's website. So this first one is Project Aware, which is Advancing Wellness and Resiliency in Education. And these specifically are state education agency grants. And the purpose of this grant is to increase student access to evidence-based and culturally relevant trauma support services and mental health care by developing innovative initiatives, activities, and programs to link local school systems with local trauma-informed support and mental health systems, including those under the Indian Health Service. So here is kind of what it looks like on grants.gov. Again, it's not a lot of information because it's considered a forecasted grant, but once it's on SAMHSA's website, there will be a ton of information. It'll be a huge PDF downloadable packet that everything has to do with this grant and how to exactly apply. But I kind of wanted to just put it on your radar since this hopefully will be posted within the next month or so. And so I also included the opportunity number. So if you want to see any more details now, you can go to grants.gov and put in this opportunity number. So we're expected to issue 7 awards. I wasn't sure about actually how much each is going to be. It looks like 6.7 is the estimated program funding. And so it kind of, I didn't want to put it down just in case it might change since again, it's a forecasted opportunity. But the eligibility will stay the same because that is by statute. And so it is available to state education agencies, local educational agencies, and Indian tribes or their tribal educational agencies. And this is a grant program that has had a lot of success. I know it's pretty talked about on Capitol Hill a lot. A lot of members are very interested in this. because it really has been shown to make tremendous success in children's lives. And I think right now we've seen with COVID, anything that we can do to help our young children, young adults, teens with mental health, we need to intervene and prevent, future issues from developing. And we can do that by starting at an earlier age. So the next grant program that again is forecasted, we are expecting it to be officially put on the SAMHSA website, calling for applicants, again, hopefully within the next month, but we don't have a definitive deadline. This is actually a new grant program, and it's considered a pilot grant program because it was authorized through the appropriations reports instead of a specific, there's not a specific law and statute for it. But the purpose is to create or enhance existing mobile crisis response teams to divert adults, children, and youth experiencing mental health crises from law enforcement in high-need communities. And so part of the reason that this was kind of introduced and set up is in July of this year, the National Suicide Prevention Lifeline will transition from being that 1-800 number to 988. And it's really we're trying, with SAMHSA and the government to create a behavioral health line that really mimics 911. And a big part of that is making sure that if someone, is in immediate need, if they have, just attempted suicide, or, they're in a mental health crisis that needs immediate attention. I'm sure we've all seen the news that unfortunately, sometimes that ends with law enforcement being involved, and that may not be what someone needs at that time. And so these mobile crisis response teams, sometimes they are with law enforcement, sometimes they're not, but they are an incredible key to making sure that we are giving people in our community who need that help the best possible care within their community without, handcuffing them and bringing them somewhere, or, anything else that a shooting or anything else that might happen. And so, but it's specifically important to pair that with the National Suicide Prevention Lifeline, which will be 988. And we are expecting a surplus of calls because it will be an easier to remember number. And so that's exactly why this is kind of being introduced at the same time. The expected number of awards is 12. Again, that might change, but that is what is being expected. And it's eligible to nonprofits in the communities. Again, since this is a new program, we don't really have anything on SAMHSA's website about past grantees or anything, but this will be posted eventually and hopefully soon. And if you do want to go to grants.gov and see a little bit more, that is the opportunity number. So there are a lot of things that you can do to kind of improve your chance of receiving an award. It kind of depends on the grant program. A lot of the time, though, hundreds of applicants are applying for just 12 or 8 awards. And so I highly recommend kind of, if you are applying for a grant, if you're the grant writer, that you look at SAMHSA's kind of tips. We have a YouTube channel this is the exact title, the SAMHSA Applicant Funding Opportunity Announcement Tutorial. And that's available on our website as well as on YouTube. And it kind of is a 101 on how to apply for grant, tips, what to make sure that you put in your application. There's so many small things that, you don't do one small thing and it's going to decrease your score. So making sure that kind of everything is done, that your I's are dotted, your T's are crossed kind of thing. And all of these resources are available on SAMHSA's website. And if you go on SAMHSA's website under grants, where those grant announcements were, 2 down, so the applying for a new grant, you can click on that. And that's where you'll get a ton of resources on how to apply for grants. And usually, or always, when the new grant program is added to the SAMHSA website, is officially announced, and not just on grants.gov as forecasted, there will be someone's name at the bottom, and that will be the person that is kind of overseeing the grant program within SAMHSA. And so you also can reach out to them if you have specific questions about the program. They will usually do a webinar for future applicants. So then you can ask specific questions there, but they'll do the webinar on kind of how to apply, what are tips, basic, 101, but specifically tied to that grant program. And so if you are interested in the, previous 2 grants, I highly recommend paying attention to the website. And as soon as that is dropped, you'll see that there is a webinar to go with that application process. So wanted to switch gears a little bit and highlight some of the SAMHSA grantees that are within the SAMHSA Center for Mental Health Services that are within this congressional district. So right now we have at least 3 grantees. I did not look at the substance use ones since those are outside of my purview, but these 3 are active grants that are within Texas 16 that are mental health grants. And interestingly, they all started a few months ago on September 30th of 2021. And as you can see, some are a 2-year grant, we have a 3-year grant, and a 5-year grant. So that kind of just shows you of the various different grant programs of how long they may last. And I'm going to give just a little bit of an overview of each one so you can see what's happening in your community. So this first one is the Garrett Lee Smith Campus Grantee. And it's the University of Texas, El Paso. And this grant program is for suicide prevention services for college campuses. And it's eligible to any higher education entity. So that could be a community college, a university, a technical college, a tribal college, the public, private, religious, it doesn't matter, though any higher education is able to apply. So the University of Texas, El Paso was awarded this grant in September, and this is what they plan on doing. And so it's just in the first year. And so I wasn't able to pull what has been done because they have not done an annual report yet, since that will be done this September. But within their application, this is what they plan to do. So they plan to train campus personnel, which includes health workforce, first responders, students, staff, and faculty as QPR gatekeepers. And QPR is a training program specifically for suicide prevention and specifically for community members. It's not a clinical gatekeeper training, but it's really for kind of everyday lay citizens. They also plan to train first responders and law enforcement in suicide prevention, intervention, and postvention to recognize and respond to signs and symptoms of mental illness. They are working to establish and expand linkages with campus and community-based organizations, departments, and stakeholders to identify and refer individuals with behavioral health issues and precursor risks. They are doing peer education to promote stigma reduction and also highlight the available services and resources within not only the campus, but within the community. And finally, they're working on expanding social media prevention messaging. Most college kids are on social media, and so really trying to get out messages about help-seeking behavior and reducing stigma is really important for our campus grants. The next one is also the University of Texas, El Paso, but they are the organization and working then within the greater community. And it's a mental health awareness training grant. And so as part of this grant, they are working throughout El Paso and throughout the kind of greater community to train first responders, all levels of law enforcement, teachers, veteran service providers, counselors, and caregivers to recognize the signs and symptoms of serious mental illness or serious emotional disturbance, which is for children, and how to respond safely, how to identify individuals with mental illness, and how to employ a crisis de-escalation technique if needed. They're also working on establishing and expanding linkages with community-based organizations in order to coordinate those available services for individuals that are in need and to make sure it's done in a timely manner, which is very key. And finally, to educate multiple tiers of serious mental illness and serious emotional disturbance responders and community members about the resources that are available on and off campus to safely respond to individuals with mental illness in a timely, sensitive, and culturally appropriate manner. And finally, there is the Emergence Health Network, and they have the Community Mental Health Centers grant. And so what this is, it's a 2-year grant to really help bolster a community mental health center and provide very needed funding. So their grant is working to enhance the crisis response for adults with serious mental illness or with co-occurring disorders. They're actually working within El Paso Independent School District to introduce school-based mental health services in 4 high schools and 1 middle school. They're introducing the CORE program in partnership with the El Paso Police Department and Sheriff's Department. And they're also using funding to continue providing on-demand telehealth services. So I've shared a lot of resources and a lot of things that are on SAMHSA's website, and it is hard to keep up. I can say that as someone who works at SAMHSA. There's a ton that we do, and paying attention can be very challenging. So we have a way to sign up for our emails. And I think what's really great about this is you actually can click of what you want to receive. So if you sign up and you only want to see grant announcements, then that's the only thing that you'll get. You can also sign up for our news publications, press releases, bulletin, media advisories. Our blog will usually release a blog if there's, a certain like Mental Health Awareness Month, or in September for National Suicide Prevention Awareness Week. And then there's also specific newsletters. So we have 2 that are actually specific to the Disaster Technical Assistance Center. And we also have just a general SAMHSA headlines newsletter. And so I can make sure to post the link actually in the Q&A section. So if folks want to sign up there. And I kind of went through this quite quickly, but I did want to leave a lot of time for Q&A, or honestly for me to show my screen or talk about other grant programs. But this is also my contact information. If you have a question I couldn't answer, please feel free to reach out to me and I will get back to you, or I will find the answer. I think that, there's so much that's being done across the government, and so many available resources. It's hard to keep up with everything that's being done, hard to keep up with all the funding opportunities out there. And so anything I can do to help your community, just please let me know. And I don't know if I should stop sharing or if I should go back to another part of the screen. I don't know if anyone has questions.
Oh, no. So at the moment, we don't have any questions in the Q&A. We'll allow a couple more seconds to see if anybody has a question and can put it in the Q&A. In the meantime, Dakota, I'm going to copy or let me enter your email in the chat. Or actually, well, they have it here up in front of them. So we'll leave the page so that they can take it down if they need it. But in case we don't have any questions, again, this webinar was recorded and we will be sharing with all of those who registered. And for those who were able to attend, thank you so much for attending the webinar. I still don't see any questions in the Q&A, so I think we don't have any questions as of now, but as Dakota mentioned, there is her email and the website, so if you have any questions, please feel free to reach out to her, or you can also reach out to me as well. And let me put my email in the chat, although you all...
And I'm sure, it's a little bit of a struggle that so many of our grant opportunities just got posted. But again, there are so many, I'll kind of go back if I can, just highlighting there's so many different grant programs. Like, I don't even know how many there are a lot to keep track of. And so if you sign up for the SAMHSA emails, you'll see a lot, but also if there's something specific you want to know if we do a grant program on, please reach out. There's just so many, it's hard to choose which to go over, which is why I specifically highlighted the ones that have future funding announcements. But again, anything about mental health, or behavioral health in general, it is a huge, giant probability that we have a grant program that could fit those needs. And we really do try to get it throughout the country. We try to do what we can to make sure that high priority areas are being met. It's not just, the giant Los Angeles, New York. I can say that as being from Los Angeles and worked in that district office, but it's a big city. And so making sure that it is also going to smaller cities, to rural areas, to, again, not just the coast or not just the middle of the country, but really trying to get our programs to the widest reach as possible. So I can just share like one anecdote is I used to work in the suicide prevention branch, and with our 2 Garrett Lee Smith grants, which are both the youth suicide prevention grants, and the one that I talked about with the University of Texas, El Paso, just in the year 2021 alone, we were able to touch, I believe it was 46 of the 50 states had at least a state grant, a tribal grant, or a campus grant. So that's just kind of a quick anecdote to highlight how much funding is out there and how much, especially right now, attention is being paid to mental health. And so there's just so many new grant programs that are being created or being talked about in Congress. And so even within next year, I'm sure there will be new programs that are able to be applied for.
Awesome. Well, thank you again, Dakota, so much for all of this really valuable information. And it was a very informative session. So thank you so much. And I think we still don't have any questions, so we'll go ahead and end the webinar. But from our office, thank you again, and those who attended, and we will be reaching out with that recording soon. Thank you.
Thank you, everyone. Have a great rest of your day.